Hi! Today I am going to be talking about the disparities in receiving services that clients in rural or distant areas experience in the state of Arizona. So, I want to open with something I noticed at my BSW internship last year. There was a woman who would wake up at 4 in the morning every single morning along with her two kids who were 6 and 10 years old. They would all get ready quietly in the dark and they would walk together to the bus stop. After her kids left for school, she also would take the bus, but to Phoenix. She had back to back to back to back appointments, which were all required in order for her to keep custody of her children. She had to go to therapy. She had substance use treatment. She had meetings with her DCS case manager. She had supervised visits and court check ins. And then, after all of that, at the end of the day, she would take the long bus ride home. She wouldn't come home until late at night. She would be exhausted. You could tell, and it seemed like she maybe didn't even have time for a real meal because she'd been out all day. And after thinking about this for a little bit, I realized she was experiencing these challenges and she wasn't even rural. She lived in Maricopa County in our shelter, and it still took her hours just to get basic services. She also didn't have a working phone, which meant that telehealth wasn't an option for her, unfortunately. So she had to show up in person no matter how far, how hot, or how tired she was. And this highlights the issue of mental health care in rural communities because it's been neglected for far, far too long, and Arizona is no exception to this. In fact, according to the 2025 county health rankings, the state of Arizona ranked the 8th worst for health disparities between rural and urban areas. There are mental health challenges statewide, but people in rural communities face barriers that might leave them with no options for support. These gaps in care reflect systemic failures, and they can be life-threatening, and they're entirely avoidable. More than 60% of rural counties across the US don't have enough healthcare providers. Arizona follows this exact same trend. So, counties like Apache, Greenland, La Paz all face severe provider shortages. Pinal County as well. Some residents in these areas often have to travel hours just to find basic behavioral health services. So, for example, a senior living in the city of Superior, way out east in the mountains, might not be able to get the care they need if they have unreliable internet access, and the only option is to drive to Maricopa County, which is anywhere from an hour to 2 hours of driving just one way, or they can try their luck at driving the 20-30 minutes it takes to get to Globe, which is also very small and may also not have the services that they're seeking. So this just highlights some of the issues that people might experience when they live in these areas. And these are the people that live in rural areas. There are people that live on maybe the outskirts of Gilbert or South Chandler that don't have a car and have to commute into the Phoenix area in order to get services. In these counties that I mentioned, people experiencing poverty make up 20% of the population in those counties. Even within Maricopa County, transportation can take hours just to get an appointment, and that unfortunately makes in-person care unfeasible for people who are low income. It's also essential to recognize the diversity of low-income individuals because these communities are not homogenous. These small towns, these small counties, these rural areas, they consist of veterans, of indigenous communities, of LGBTQ individuals, seniors, low-income families, people of color. These marginalized populations face additional barriers when they're seeking care. Rural Arizona land includes indigenous reservations, farming communities, and small towns that have unique needs. people of color and LGBT people do have higher reporting of having a difficult time finding providers who are able to offer culturally attuned, trauma informed care, and a lot of them have fear of judgment or fear of privacy in small towns, which might help them from seeking services altogether. And there have been efforts to address these disparities, but there are still gaps in care. So, one example of this is the Mental Health Parity and Addiction Equity Act of 2008. This required insurance companies to cover mental health care at the same level of physical health. The Affordable Care Act also expanded mental health coverage, which made it a required benefit. Medicaid expansion improved access to care for many Americans, particularly in rural counties. There are also programs like the National Health Service Corps, which have helped place providers in shortage areas. Unfortunately, the demand for providers still outweighs the supply, and demand is only rising, especially now as people are starting to experience more and more mental health concerns that they want to address. During the COVID-19 pandemic, there were expansions in using telehealth, and this did allow for many people to access care from their home for the first time. And since the pandemic, there has been a wider usage of telehealth services, which has led to a broader acceptance and usage of telehealth from providers, but also from clients. And it's especially important for rural Arizona because provider shortages and distance have always been significant barriers for people. The success of telehealth in these communities shows what is possible when meaningful access to healthcare is prioritized. Even with these policies in place, there are still major problems. The parity laws are not consistently enforced, and not all healthcare plans are required to follow them. In addition to this, telehealth can only work when you have stable internet access, and the broadband infrastructure in Arizona can be unreliable in a lot of areas, especially like remote cities or places that, aren't in the Phoenix metro area. And the shortage of mental health providers across Arizona continues to grow, especially for underserved rural regions. These challenges leave a lot of people without access to care, and the burden falls the hardest on people who are already experiencing oppression or discrimination. The stakeholders in this issue involve the residents of rural areas, policymakers, healthcare providers, organizations, and the donors who are able to help fund these healthcare initiatives. There are clear policy changes that can make a real difference for this. The first one is permanent telehealth expansion as a top priority. Widespread access is a basic need for people and not a luxury, and Arizona's rural infrastructure has to improve in order to solve this issue. There should also be equal reimbursement for telehealth services that are consistent with in-person care to make sure that providers are able to continue offering virtual services. And it would also be beneficial to provide information on telehealth options to people who might struggle with making it to their in-person appointments or who are late to their in-person appointments. Another step is increasing the number of mental health professionals in rural communities, and this can be done by incentivizing people to go to school for mental health services, or maybe offering scholarships for people so that they're able to go through school, and that relieves the financial burden on their behalf, because there is a huge shortage in these areas. According to Mental Health America, 65% of rural counties don't have a psychiatrist, and 81% do not have a psychiatric nurse practitioner, which means that if you are seeking a diagnosis or seeking medication, or maybe you're already taking medication and now you've moved to a new area, You're either going to have to drive long distances to be able to get the care you're looking for, or you're going to need to see if you can find a telehealth provider, or some people might just not seek care because of the barriers. I think that also expanding programs like the National Health Service Corps can help to bring mental health providers into rural counties, um, and also just encouraging more people to pursue careers in social services. I think the state of Arizona should also invest in peer support specialists and community health workers, because they would be able to provide care for individuals who might be hesitant to engage with the formal healthcare system. So having someone in peer support who has gone through something similar and are able to, you know, provide those services for someone to make them more comfortable, would also be a huge benefit to people in rural areas. And then, last but not least, Medicaid expansion. Medicaid has to be protected and strengthened no matter what. Arizona's decision to expand Medicaid in 2013 was completely essential for improving healthcare access, and more can be done to simplify the enrollment and address disparities. There are states who have refused expansion, and these leave their rural residents with fewer options. But Arizona can continue leading in this area if policymakers continue to address the issue and continue to advocate for the issue. Unfortunately, under the current presidential administration, the efforts surrounding Medicaid are primarily focused on preserving it and not expanding it. A lot of discussion around expanding it is shut down immediately from Democrats and Republicans alike, which makes it very difficult to make any progress in expanding access, especially now with the recent legislation that was passed where 17 million people are about to lose Medicaid access. And 1 in 5 people in Arizona are potentially going to lose their health insurance. Despite all of these issues, that doesn't mean that we should completely abandon the effort. It's still necessary, and efforts to expand it are going to take many years of campaigning, of raising awareness, and electing officials who serve our best interests and do see the urgency around the public health issue. Mental health care in rural Arizona demonstrates disparities in equity across the state and even across the country. Marginalized communities deserve to have providers who are culturally responsive, trauma-informed, and are able to meet their needs and meet them where they're at. Improving provider diversity, expanding access to services, and addressing the root causes of these disparities is completely essential. Rural Arizona cannot be left behind in mental health policy conversations. The solutions exist. The choice to fight for and implement them is what matters now. Thank you.